Today, we're going to talk about abnormal uterine bleeding and spotting, which can obviously be a very concerning issue for many women. And sometimes it needs immediate medical attention. When is it a major problem, and what are some of the reasons? I'm Dr. Christina Hammer with Vibrancy VIP Med Clinic, so let's get started. First off, what is abnormal uterine bleeding and spotting? Well, it's a condition where a woman experiences bleeding or spotting outside of her normal menstrual cycle. This can be caused by a variety of factors and can have different implications depending on the cause. How prevalent is abnormal uterine bleeding as well as spotting? It's estimated that up to about 30% of women will experience abnormal uterine bleeding and spotting at some point in their lives. It's most common in women who are in their 30s and 40s, but it can occur at any age. So, let's talk about some common causes as well as symptoms of abnormal uterine bleeding and spotting. Some common causes include, but are not limited to, hormonal imbalances, such as those caused by thyroid disorders or polycystic ovarian syndrome, which we like to abbreviate as PCOS, uterine fibroids or polyps, as well as endometriosis, and pelvic inflammatory disease, which we abbreviate to PID. Other causes can also be certain medications or contraceptives, which are considered birth control, as well as cancer or precancerous conditions of the reproductive organs. So let's talk about some symptoms of abnormal uterine bleeding and spotting. Can vary depending on the cause, but may include bleeding or spotting between periods, heavier or lighter than usual menstrual bleeding, bleeding or spotting after intercourse, bleeding or spotting after menopause. If you're experiencing any of these symptoms, it's important to talk to your healthcare provider. They can help you determine the underlying cause and provide guidance on treatment options. So, how is abnormal uterine bleeding spotting diagnosed? Well, your healthcare provider may perform a physical exam as well as a pelvic exam and order or imaging tests such as an ultrasound or MRI. They may also perform a biopsy or even a pap smear to check for cancer or precancerous conditions. Prevention and treatment options for abnormal uterine bleeding and spotting depend on the underlying cause. Hormonal imbalances can be treated with hormone therapy or certain medications, as well as fibroids or polyps, as well as endometriosis or PID, may require medication or surgery as well. It's also important to maintain a healthy lifestyle, which can help prevent hormonal imbalances and other underlying causes of abnormal uterine bleeding and spotting. This includes eating a balanced diet, getting regular exercise, and managing stress. So that's all for today's video. Remember to always prioritize your health and well-being, and don't hesitate to seek guidance from your healthcare provider if you're experiencing any abnormal uterine bleeding or spotting. Please reach out to me if you have any questions or comments, and don't forget to like and subscribe to the channel. And if you'd like to set up an in-person or telehealth appointment, please visit our website in the links below. Thanks so much for watching the video, and we'll see you in the next video. Bye-bye.